When you endure a trauma such as your parents' divorce or extreme family dysfunction, it doesn't just affect your emotions, it affects your body too. It literally has physical effects. And in this episode, I'm joined by Dr. Christopher Genn, a physical therapist and expert in applied kinesiology, where he's able to explain how our bodies respond to trauma and what we can do to heal. We also talk about things like a new therapy to treat pain, trauma, and even to rewire bad habits. He also tells a story about a girl who went through her parents' divorce and how it literally had physical effects on her. We talk about the balance and healing between accepting where you are today, but at the same time striving for a better life and a healthier you. And finally, we hit on how we often lie to ourselves about our families, about our past, and even about our parents, and how that's super unhelpful, how it's such a barrier to healing. So a lot of great stuff ahead. Stay with us. Welcome to the Restored Podcast, helping you heal and grow from the trauma of your parents' divorce, separation, or broken family so you can break the cycle. I'm your host, Joey Panarelli. This is episode 113. We're so thrilled that so many of you have found the podcast helpful and even healing. We've heard tons of great feedback. One person left this review. They said, "The community that's needed." I feel so grateful for this podcast. After my parents' divorce, I was left with a lot of unanswered questions and feelings, leaving me confused and isolated. My friends and family did their best to be present for me, and counseling helped, but this community of others who have walked the same road and chosen a different path, one of love, peace, and forgiveness, continues to encourage me years later. Wonderful, practical, hope-giving. Again, we're so happy that it's been so helpful for you. We do it for you. Again, my guest today is Dr. Christopher Genn. As a child, he experienced these extreme headaches and vomiting, which actually led to 5 brain surgeries, if you can believe that. And that sparked a passion in him to really better understand the human body, pain, and healing. And he graduated from Mercy College with his bachelor's in health science and a certified strength and conditioning specialist certification. He then completed various clinical rotations working in orthopedic, acute care, and pediatric. And Dr. Genn became certified in something called functional movement systems. And he worked alongside this physical therapist who was trained by the American Academy of Manipulative Therapy. And that led him to learn these advanced manual therapy skills, including spinal and joint manipulation techniques. Eventually, he launched his own practice. It's called Be Not Afraid Physical Therapy. He launched it to better serve his clients, where he became fully certified in a new therapy called QNRT and applied kinesiology, which you're going to hear a lot about in this episode. And in this episode, we do talk about God and faith. And if you don't believe in God, you're totally welcome here. Anyone who's been listening to this podcast for a while knows that we're not a strictly religious podcast. And so wherever you're at, I'm glad you're here. If you don't believe in God, I just challenge you to listen with an open mind. Even if you were to take out the God parts, you're still going to benefit from this episode. And with that, here's my conversation with Dr. Christopher Genn. Dr. Genn, so good to have you on the show. Thanks for being here.
Thank you so much for having me. I'm very excited.
I'm super impressed with you. I mean, we've known each other for a while, and just looking through all the work you've done, I'm, again, very impressed in how you've really taken your own pain and transformed it into something to help other people. And I was thinking about this before the show. A lot of times people who get in your line of work, they often do it for practical reasons, because maybe they were really good at it, or they have a passion for it, or it's just a way to pay the bills. And while some of that might be true for you, there's a much deeper reason. You didn't learn about suffering. You didn't learn about pain and healing in a book. You've really lived it. And so I'd love to know your story.
Sure. I mean, my story really started at a very young age, before my memory started, and in my first year of life even. So I've been told that every month or so I'd have at least 3 or 4 days worth where I'd have 105 plus degree fevers and sweats and everything that goes along with fevers. And the doctors and everybody, they couldn't explain it. And it was untreated and went as such for at least a year, a little bit more than a year, I think. And that subsided. And then after that, around 5, I started having real severe headaches. And they were so bad, they were accompanied by vomiting, profuse vomiting for days, sometimes, and they'd come and go, and they gradually got worse.
Wow.
And we tried to have them evaluated, and my mom's a nurse, and so she kept kind of pursuing it. And the doctors at that time said, they're just childhood migraines. Take some Tylenol and, go rest. So as it continued for months and months, and I'd be vomiting in the office, in the waiting room, in the office, and everywhere with a pounding headache. And they finally put me in for an MRI. And when they did that, they found a huge cyst the size of a plum in my 5-year-old brain. And that was causing many of those symptoms. So I was put into emergency surgery, but not quite emergency because they had to calm down the inflammation because it was so high. So after a couple of days, they put me into surgery. And I ended up having 5 surgeries before the neurosurgeon was able to regulate the pressure within my head. And I was blessed. I was spared from having any seizure disorder at that time, which the neurosurgeon was very surprised. But through that suffering, I really learned the gift. I was taught the gift, actually, by my parents. And I learned it very much firsthand to offer up the suffering, to offer it up for other people, to offer it up for people I loved, and to really give it over to God at that time, because I was not in control of it. I couldn't do anything about it myself. There's nothing I could do to control the pain and the suffering. So I learned that there was a way out, in a way to make the pain meaningful to me. And that was through offering it up. And when I learned that, it really did help. And I have many, many blessings, many stories where I was very much accompanied by Mary. At that time, I learned that Mary was, the mother of God in our Catholic faith. And as I learned that, she was somebody I turned to, and she was always there for me. I could always turn as somebody who comforted me as a young child. And so that was really the big suffering. And it continued over the years, even after the surgeries. Wow. Every time I'd play sports, do something that I absolutely loved, I would be up the majority of that night with splitting headaches and vomiting, even after the surgeries. But I never stopped doing what I loved, but I would have to suffer afterwards. And, they eventually did subside. Probably, I don't remember exactly the time frame, but by the time I was probably 9 or 10, they more or less subsided. Anyway, jumpstart forward a bunch of years, at the end of grad school. And I was married, end of grad school. We had our first child, Gianna, and I started experiencing, I was training for a marathon, I was in great shape, etc. And I started getting those same headaches. And I hadn't had that intense of a headache since I remember when I was a young child. And I said, man. Anyway, I kept pushing it off. They're just allergies, It was allergy season. I had allergies before. And I went to the doc and he said, well, you could treat it as allergies if you want, see how it goes. Anyway, it only got worse. It didn't help at all. So I'm out at my in-laws and they see a chiropractor. So I was never raised with natural medicine, but my wife, she was very much raised that way. So I was out in my in-laws visiting for Easter, I believe it was. And I was getting my headaches. I couldn't do anything about them. Nothing touched them. And I was vomiting all night that night. I said, and my in-laws were like, you got to go see, Dr. Kathy, who they had seen. And they said, she'll be able to help at least figure out what's going on. I was like, okay, I'll take anything. So she's a chiropractor who does muscle testing. And that was my first introduction. So she took me in as a friend of theirs. So she didn't even do a full evaluation. She just took me in and said, let me just see what's going on. And she did her evaluation. And she knew nothing about my history. And she said, is there a reason that your cerebrospinal fluid, which, by the way, my cyst when I was a kid was filled with cerebrospinal fluid. That's the type of cyst it was. And she said, your levels are off the charts. There's something wrong. And I was like, how did you just figure that out? He's like, you know nothing about me.
Yeah. Wow.
And she just did muscle testing. And I was like, yeah, there's a reason. You know, I have a shunt and it drains the cyst with cerebral spine. You need to get that checked out. So I was like, all right, I need to, you know, I went back to my neurosurgeon and sure enough, the tubing had corroded and it was no longer functioning. So I had a flare up. So
wow.
At that point, I had never experienced that. I was at the end of grad school. As I said, physical therapy. I was led to physical therapy and I loved what I was doing. And then this kind of stopped me in my tracks and said, whatever she just did, I have no idea what she just did. Whatever she just did was meaningful because like that gets to more than just, oh, these are your symptoms, let's cover it up. It was like, no, she could tell what was the most important thing by just muscle testing and evaluating my entire system as a whole. And so that was the start. And I said, at that point, I graduated and then I said, you know, I'm going to hand this over to God. I'm going to say, you know, lead me to learn something like that I can really help people and do it in your time. And I kept looking for opportunities to learn any type of muscle testing. And all the doors kept closing for me. And I was like, all right, and I'll put it on the back burner for now. And I kept looking into it again and nope, not this time. So looking back, I have many ideas as to why I didn't learn it quite right away. I had so many things to learn about prior to that. But eventually, a couple years ago, it was the right time. And I launched pretty much, as my wife told everybody, pretty much back into like graduate school almost. And I launched full steam ahead into a 100-hour course in applied kinesiology. And that's really what allowed me to see what she did. And even further than that, allowed me to realize the impact of what I went through back then and how it's actually interconnected with what my family was going through at the time. And the pain and suffering that was there. And how that had impacted my suffering on a physical level. And in ways that, for instance, when I was at one of the seminars, again, these guys don't know anything about us or whatever, you know, and we're testing each other. And, you know, he isolates a spot here on my head where the cyst happened to be. He didn't know that, but he said, you know, and he narrowed in some emotions, wow. Some things that, you know, were affecting that region. He said, you need to address what's going on there. And I was like, you know, in my head, like all these thoughts. I'm like, what? Whoa! Like, are you kidding me? Like, and I told him, I was like, I have a VP shunt in my head that drains a cyst that I've been told is pretty much where you're pointing. And he's like, that's not surprising. And he had been doing this kind of work for years. And I was like, that's not surprising. I was like, yeah, it is. Are you kidding? I mean, that brings a whole new light to like everything I've ever experienced. Like, and that was the opening wow. of my door personally, to actually experience what I had been starting to learn and, have now been graced to continue to experience personally the healing, of that type of work, because the physical stress that I was under was just a presentation of what I was kind of experiencing around me at the time, and my body trapped in, and has affected me in many, many ways ever since then, that I've come to learn through some of the work that I've experienced.
Incredible. Thank you for sharing so vulnerably. And I want to go deeper into a couple things. One point I just wanted to make is it's beautiful how your pain didn't crush you, but you allowed it to transform you. Sadly, you know, you could look around the world today and see people where their pain crushes them. It truly does hold them down. But it's beautiful how you didn't let that happen. And you, by God's grace, as you'd say, were able to transform that. And then now even use that as a way to help other people, because you understand pain on a deep level. You know, again, some people understand it kind of intellectually, but they've never suffered much. You've suffered a lot, which I think would totally change if, you know, a patient comes in and you're helping them through some problem they're facing, whether it's physical or emotional. You get that on a deep level. So that's really beautiful. I also admire the balance you had, and I know when you were younger, this is maybe more of your parents kind of instilling it in you, but how you had somewhat of an acceptance of where you were. It's like, okay, I'm going through all this pain. Like I'm throwing up, I'm, have these horrible headaches, like all this stuff that you were dealing with. But at the same time, you were striving to find a solution. And I think that's a tricky balance, because I think on one end we can just give into resignation thinking, well, my life is just always going to be this way. All I can do, and I know we're going to get into this, but all I could do is really manage it. Or, kind of even just having this ultra focus on finding some sort of utopia, a solution that will make, life perfect. Neither of those are healthy, obviously. And so it's cool to see kind of how you had the balance between the two. But what I want to focus on, and feel free to comment on any of that, is just the pain in your family. That stood out to me, especially given our audience who comes from broken families. So I'm just curious, like, what was that impacted you, not only emotionally, but also physically, whatever was going on in your family?
First I want to touch on the acceptance, because, anybody knows that if you stub your toe, and if you're in the middle of something really important, you can put that aside and focus on what's really important in front of you. If you're alone and you're doing something, you stub your toe, that's like the end of the world. You're like, oh my gosh, that hurts so bad. But if you're like, in an interview, for instance, and you stub your toe on something, you're going to kind of, push down your reaction a little bit and accept the fact that, it hurts, but I'm okay. And, that's a hard place to be. Accept pain and accept suffering and realize that that's actually not the end of the story. It's actually the launching pad, right? Pain and suffering in our life allows us to grow. Anybody who exercises, right? When you exercise, what do you have to do? You have to stress the muscle. You have to strain the body. You have to push past the limit that you think you can handle. But what do you get out of that? You get the awareness that you can actually do more than you thought you could an hour ago. You get the increased growth of muscle. You get the increased ability for your body to do more, to go further, and to experience greater heights of enjoyment. But if you just think, I'm stuck here and I can't endure any more suffering, then there's no more growth. And so yes, your point of accepting that pain and suffering, whatever it is, whether or not it's a physical pain or suffering, or whether or not it's purely emotional, and you're just having total anxiety or deep depression, accepting the fact of where you are is a huge first step. And that always ends. I had a quick scenario. I had a gentleman
Please.
in, and first time working with him, and we evaluate what's going on, et cetera, and I ask him, and I go, what was going on between 3 and 5 years old? And he goes, I don't have much memory at all of my childhood, but, and then he thinks and, comes out. He's like, oh, but my dad was an alcoholic and he died when I was 6, but, he was a good father. And through my testing, I'm like, yeah, but your system doesn't believe he was a good father. So I go, so could you just say that again for me? And he goes, my dad was a good father. And I muscle test him, which is testing whether or not that statement is congruent with his entire being, because our system responds to statements like that. And so consciously, he's told himself, because it's important for us to have a good father, he told himself that my dad was a good father. He doesn't have many memories of it, but he was an alcoholic and there was tension there. So I said, say that again, and his arm goes weak. He goes, wait a second, does that mean that my subconscious, my entire being doesn't actually agree with that statement? I said, that's exactly what that means. And that was the root of it. That he didn't accept the fact that, oh, my father actually was not a good father. And if we don't accept what reality is, we can't then address it. We can't allow healing if we don't actually look at it and see it for what it is. So I didn't know what was going on in my family back then. I had no idea. I had no conscious awareness at all, really. Looking back, I thought I had a great family life. I thought it was peachy, so to speak. But after having worked with my parents and in the work that I do as well, and having worked on it myself, I realized so many things are linked back to that time frame. and linked back to difficulties within my parents' marriage, infidelities linked in my parents' marriage, and generational sins and difficulties and patterns of impurities and infidelities within marriages in my father's line, and how that actually has impacted my genetics. Things that get passed down genetically, right? They actually can be patterns of sin or patterns of bad decisions, and they can get passed on, and they get trapped in our tissues. And so, looking back, there were those patterns in my parents' relationship at the time, and I was kind of like the scapegoat, so to speak, or I had to be the person to regulate. And when stuff was going on and I couldn't regulate, I had severe headaches, I had severe symptoms, or later on I had, I had the high fevers early on in my first year of life. These things were probably related, or actually definitely were related to some of the things that were going on in my parents' marriage, in their experience. And so, learning that now, it links a whole lot together for me. And it allows me to actually address things that I wasn't fully even conscious of. Because again, I didn't have memories at 1 year old. I didn't even have memories at 3, 4 years old when I started the other symptoms. So, families that are broken, there's many more repercussions. And so often we don't allow ourselves to accept them, or allow ourselves to say, you know what? My family situation is not good. And as a 5-year-old, I can't really do anything about that. And it's not my role. I took on, and I very much even consciously took on from a young age, the responsibility to kind of manage the family, to balance the family. And I was always extremely aware of my mom's mood or my mom's situation, or I always had to kind of watch out there, or even amongst my siblings, I would try to kind of be the peacemaker. Or I was never really a part of the discord. I felt like it was my role to accept it, and then kind of my body couldn't take it anymore and it would erupt. So that's a little bit about,
Makes so much sense. No, it's so fascinating. And gosh, so many lessons I'm learning from you. A couple things I wanted to mention. One, just this fact that we lie to ourselves, like that patient that you had. Fascinating, right? And I'm just thinking in my own life, man, how often have I just lied to myself, where what's coming out of my mouth just doesn't align with reality. It doesn't reflect reality. Mm-hmm. It's just not actually true. That's one thing. The other thing too is just, please. Yeah. And the other thing I was just going to mention is this whole field of epigenetics, just to make sure everyone, because I think sometimes what people, when they hear some of the things we're talking about, they may think that, well, that's kind of like phony. It's not real science. It's like, no, this is real science. Like this whole field of epigenetics, from my understanding of it, I'm not, like you, clinical science trained, but my understanding of it is it's looking at the ways our genes express themselves based on our environment. And an example that was kind of given to me is in your genetics, you might have a predisposition to be an alcoholic, but if your environment never kind of triggers that in you, you could go through your life and not struggle with alcoholism, or you can be in a really difficult situation and then start becoming an alcoholic in order to cope with the pain in your life.
Who doesn't have that predisposition.
Exactly. So, right. So in this field of epigenetics, from what I understand, is like we're still discovering so much right now. And so feel free to speak to any of that. But yeah, lying to ourselves, it's super real. I didn't realize it until you just said it.
Think about a lie detection test, right? Everybody has a basic understanding generally of a lie detection test. You're hooked up and they look on a graph and see whether or not there's a physiological change when somebody's telling the truth or when somebody's telling a lie. And they start with something basic, which is actually how I start explaining it with people too, is my name is Chris, and that's a truth. And my subconscious, my entire being should respond to that as a truth. And so if I said, my name is Josh, my name's clearly not Josh. And so that would be a lie for me. And not only is it a lie, it actually has a physiological effect on me. So it changes my heart rate. And you can see that on a graph. It changes my ability of my nervous system to function. And so that's how the muscle test then works. It inhibits the nervous system to respond normally. And which is why lying is not good for us, but physiologically it breaks us down. And you stated that fact of the epigenetics so perfectly, because some people argue whether or not these things are real and things, but it's the expression of you may have a predisposition to cancer, or predisposition to different types of cancer, or predisposition to any number of things, including then the emotional side of things, depression. That runs in families. People know things like this runs in families. You have a predisposition to it. But if you live a healthy lifestyle, have a well-functioning, stable environment, and you're not triggered, you may never fall into that. But you are more readily triggered by certain things. And then it's when those things gets triggered time and time again, that then it creates real issues, and you see the body and the person breaking down because the same triggers are there. People are rejected, and then so-and-so a boyfriend rejects them later in life, and then you end up having somebody who just gets rejected time and time again. The boyfriend keeps cheating on them. You have a different boyfriend, he cheats on you. You have a different boyfriend, he cheats. Wow. And then you get married, and then that guy leaves and cheats on you again. And people are like, why is this always happening to me? And part of it is actually the suffering that they almost bring it on, because they've never addressed the fact that they're okay having a faithful partner, because their system is patterned to respond to, I actually want rejection. And that's like when people come to the realization that their entire being, except for their conscious brain, is asking for rejection. It's like so backwards. But our nervous system can get so screwed up because it's been hurt so badly that it can be patterned to want the opposite of what our conscious brain thinks. We want to get rid of that stuff, the total rejection, and we want somebody who's going to be faithful. And the work that I do with the QNRT, the quantum neurological reset therapy, is doing exactly that. It's saying, listen, consciously, you are seeking after a faithful relationship, but subconsciously, your system is saying, nope, I'm not letting go of that rejection. I'm not accepting that rejection that I had when my father left me or left our family. I'm not accepting that. I'm not letting go of it. I'm not forgiving it. And I'm not even saying I'm okay moving on or moving forward. And when your subconscious is trapped there, you want to be ready to say, no, consciously, I do want to let go of that. I do want to forgive that. I'm actually at that point where I'm ready to do that. And as long as we have that conscious acceptance of that, then we can do the work that I do, and we can say, okay, let's do the training of the brain in a couple minutes, and let's help to repattern that part of the system that says, okay, I'm going to let go of that. I'm going to forgive him, and I'm going to be okay with having a faithful partner. And it's so powerful, the nervous system. If somebody's not consciously ready to forgive that person, and I do the reset, helping them to actually be okay with forgiving them, but they're not actually willing to forgive, they could be sick for days or weeks, because it creates such a non-congruency. Their will, their desire is not there, which is why I always have to say, as soon as we come up with what's bothering the body, are you willing to say, I forgive my father for leaving us? Are you willing? If they're not, we wait. And you have to come to the time and we can do other things to assist. But if they're not ready, the system is so powerful and has so much there that it'll create real discord. And you can suffer tremendously after that. So it's testament to the power of our nervous system.
Wow, so fascinating. what I hear you talking about, we've talked about a little bit on the show, is like repetition compulsion, how we end up repeating behavior that harmed us in our own lives, and you gave the example of infidelity, rejection. Another example, kind of going back to alcoholism, is if you grew up with an alcoholic father, you swear, I will never be like that and don't want that in my life. And then years later in your life, you end up becoming the alcoholic. And like we talked about, there's obviously the biological component, the predisposition, but there's so much more going on there. And so it's really, really fascinating. And one of the interesting statistics that has always blown my mind is how people who come from broken, especially divorced families, we're less likely to get married. We're more likely to get divorced. I've even seen some data. I don't have a lot on this, but I've seen some data that says if you were, in a family where mom or dad cheated on the other, you're more likely to have an affair yourself, which obviously is so scary for people who want, a beautiful, faithful marriage. And so it's just fascinating to see that these things that we go through in our lives are programmed into us, even perhaps down to our DNA. And unless we kind of course correct, unless we reprogram, which I believe is totally possible, we'll end up going down those similar paths that we truly fear that we're doomed to go down, even though we don't want that. So I hear you talking about all these things that are super relevant to people like us.
Right, and that's the ACE study. It's a very well-known, you can look it up, study on adverse childhood events and what that actually does to our health. Yes, our patterns, like you just mentioned, but also just our health. People who experience one or more than one, obviously as the number increases with the number of adverse childhood experiences, the rate at which their health declines is more intense the more you experience adverse events, because they're more trauma that our body cannot normalize from. And so that study shows, that they'll have more, I can't remember exactly the diseases or illnesses that it states, but they'll have more, sleep disturbances is a common one, and asthma and chronic illnesses and headaches and, migraines and various different things. The percentage will be higher in the people who have broken families or any type of adverse childhood experience. It increases our rate of patterning. And to speak to that too, for my personal, right? I'm getting married and all I want is I want to be a faithful, husband, and I don't want to, do any harm to my wife or to my kids or repeat any patterns of, and of course, I didn't even know at that point when I'm getting married, really, of some of the infidelities and different things in my family history. But I had a real struggle personally, to be open and honest with everybody, with pornography for years, and it was a real hard struggle and battle, and it really affected all parts of my life, and. When I'm getting married, I'm like, I had been, clean for a while, and I'm like, I'm never doing this again. I'm so done, and I'm over that, right? And I'm thinking, it's all smooth sailing, and sure enough, it creeps back into my marriage, and it creates real, I can see the immediate effects on particularly my wife, the patterns, and actually a perfect example of how our body traps things. So this was actually just last night. My wife, we're sitting at the dinner table. She's doing totally fine. And then all of a sudden she's like, I have this severe pain in my neck and it's like killing me. And it stayed there for, a couple of hours. And she's like, I can't do anything right now. So she's like, so I evaluated her quickly. Wow. I said, you know what? You need to do there's a technique. Callahan, a psychologist, came up with a technique of using tapping techniques to activate different parts of the system to clear traumatic events and clear trauma from the body. And it's a wonderful technique. Anyway, I said, you know what? You need to do a trauma release from that time when I that you found out and we talked about, and it came to light that I was struggling with pornography again in our marriage. And she goes, wow, that's crazy. And she goes ahead and we do the technique, which takes all of a few minutes. And she's like, I mean, I've experienced this a number of times, but that's crazy. It's entirely gone. And it was 100%. I was gone. It was severe for a few hours, and she was like, it's totally gone. And she knows how much sense that makes, but she goes, wow, because we've been working through the repercussions of and that's an unfaithfulness on my part to our marriage. And I learned that was, you know, in my past, my grandfather and other issues going back. And wow. I was like, man, yeah. And there was no part of me that wanted to do any of that. But it was a weakness. And sure enough, it showed up again. And, you know, I always want to be like, you know, I got this. I can do this. It's no big deal. You know, I won't do it again, as I said before. It's like,
yeah,
we can do that for only so much period of time before somehow we break down. Whether or not it's emotionally, whether or not it's physically, or we get really sick. And so yeah, that was just a powerful example of how really hurtful things that we go through can present with physical symptoms, and then they can actually go away almost instantaneously. And I see that every day in my practice, which is pretty wild.
That is so wild. Well, man, thank you so much for sharing so vulnerably about, you know, those past struggles. And wow, like, I'm blown away and so fascinated by your practice and how you're helping people. And I have 1,000,001 questions, but it's clear, you know, you anticipate some of the questions so well, just this connection between our bodies and our emotions. Like, there's clearly the connection there when, you know, we go through trauma in life that doesn't have a physical component in the immediate, but it certainly affects our bodies. And you gave numerous examples there, which is amazing. You've already spoken to this, but I want to give you a chance to mention it further. Just if, you know, outside of your own story, how you've seen people who come from broken families, you know, struggle with physical, even pain or physical symptoms. Again, you've spoken to this already. You mentioned the ACE research as well, but I'm just curious if you've seen anything in your own practice of
what drove me even further to, and I think that's why I needed to wait too. I needed to be a physical therapist who honed his skills with his hands and honed his techniques with how to address the physical side of symptoms. And I worked extremely hard on that. And I was gifted. I worked under somebody who was really skilled with his hands for a good number of years. And I learned a ton. And through that work, because, not to boast, but I was told and I saw good results. So I knew that I had some skill there. But there were plenty of people I couldn't make any change with whatsoever. And they would come in every week with the same exact pain. Might get better for a couple hours, maybe a few days eventually, but they're racked with it time and time again. And I said, you know, I went into physical therapy to help people. You know, I love the human body. I love learning about it. And I love it even more now that I'm learning even deeper. The more I learn, the more I love it. It's amazing. And when I started seeing these people, I'm like, and I take my work as ministry, as, you know, God sends me my clients for me to assist in their life. And I had these people that would come time and time. I couldn't do anything to help them. And I said, there's got to be more. And I started my practice. And then I finally started learning applied kinesiology. And I started having people with the techniques that I was learning refer to me, because they would come in and they would say, I'd say, all right, you know, tell me a little bit about your story. What's going on? And I said, well, I don't really have anything physically wrong with me that I know of, really, but I have a lot of trauma in my past, and I just can't really function. I can't get a job. I just can't function. I'm like, you realize I'm a physical therapist, right? It's like, And I'm like, Lord, I guess.
Maybe they missed the
did.
physical component of the therapist.
But then I said, well, you're obviously referred to by so-and-so because I helped them with similar things. I was like, all right, well, let's go. And I learned through those people coming to me that, yes, doing work through the physical, you can actually help the emotional. And so to back up just a little bit, before I really started getting into that, there was this one girl that stands out in my mind very much. And she came in. I did not work with her initially. I didn't do the initial evaluation. One of my coworkers did. And I saw her, I think, the second or third time. And she wouldn't be able to walk. She could barely stand on her own two legs. She went from a very, very active, functioning girl to I can't move. Can't walk. She would, lie down on the table, and you would muscle test the legs and stuff, and you're like, you have strength. You have strength. You go up and stand, and she'd like collapse. And you'd have to support her. And some days, you'd have to have two people holding her, and she'd be trembling. Her legs would total tremble, and it was just like heartbreaking. And in that setting where I was, I really couldn't do that much. Well, there was one evening where I was all alone with that in the clinic, so it was quieter, so she could kind of focus. And I had just started learning some of the applied kinesiology stuff, and I was doing my business part-time. And so I was there, and I said, do you mind if we do some muscle testing? And she was like, yeah, whatever works, let's. And anyway, I came up with a few things, and I said, what's going on at home? What's bothering you so much at home? What's the struggle there? And she started really breaking down, and her parents were in the middle of a divorce, and it came out of nowhere, I guess. And they were in the middle of the hardship of a divorce, and I was like, it's like my heart just totally went out to her. And at that time, there was really nothing at that time that I knew to be able to do to actually help her in that case. I just knew, like, man, we can do X, Y, Z, any number of things. And I did everything we could, some improvement. And then she'd come back in again, totally just, and then she started getting a little bit better. And you started seeing the direct connection with her environmental stability that she would report and how she could actually use her legs again. And then she might come in with a huge flare-up, and there was again, some kind of discord there. So it was an incredible, probably my first extreme case that was like night and day between what was going on, fully functioning, totally fine, and then something hit her, bam, can't use my legs. It was a really sad case, but she did eventually kind of get through it. And at the end of the day,
beautiful. Did
she get through it for now? Yeah, but chances are she still has a lot of that hurt in there. She's learned how to navigate it, which is an important survival tactic.
Sure.
Deep, true healing is what we probably want more, because it allows us actually freedom from that, and
wow.
to be free from the bondage of that hurt, that wound, and allow that to heal. So that was one really big thing for me. And then I wrote down another one. What was the other one? So early on too, I was like, I had this client who, like, every October, it's 3 years in a row, she would come in from October to like the end of November. She'd come in for like 6 weeks treatments. And by the third year, it was the same exact thing. And I was looking at her chart. I'm like, it's like the same time of year. So this was before I got into any of this. This was just, I was, a regular physical therapist. And I turned and looked at her, and I was like, did anything happen this time of year a couple of years ago? I started seeing you 3 years ago, and you came last year for the same thing about the same time, and you're coming back this year. Just wondering, did anything happen? Because you could have seasonal triggers, an autumn time of year. The leaves change, everything changes in the air. That was her trigger. And again, she broke down at that time and said, yeah, her husband left her. And I was like, wow. And that was 3 years prior to me even getting into any of this. And I was like, and she let it out. And the thing about that was that the manual therapy technique that I was doing with her actually helped her to release some of that. She wept, she cried, she spoke it out. And I was doing just normal manual therapy, release of certain nerves and muscles and cranial bones and different things I was doing. And she really processed. Anyway, I was there at that clinic for 3 years after that, and I didn't see her again. So it was just neat to see that too. It's like, yeah.
Unbelievable. Like, I think some people listening right now are maybe having a hard time believing this.
And
it's
you can't actually fully
and I believe you
it and I 100%, I'm like really understanding of people who are like, dude, you're nuts. That's crazy talk. And I'm totally understanding of that, because it sounds nuts until you experience it. And as soon as somebody experiences it and says, my pain's entirely gone after you just did that and you didn't touch my arm. It's not until that time that they come back and they say, you know what? I haven't thought about what came up, and there was actually a whole lot more to that time frame that I didn't even realize that day I didn't allow myself to get to, but there was actually a whole lot more. And I was like, great, you don't even need to tell me, but that's great, but and not only that, now that I am in it, I see one of the other women that I treated for multiple years, and another case that I felt totally useless almost. I could, she loved me as a therapist. She said, you're amazing. And in the back of my head, I'm like, I am so thankful that you think I'm doing you such good and I'm here for you. But I know somebody or something or some other thing could do you so much better, because, she was just stuck in a pattern, and she had a lot of hurt, and IBS, colon issues, and all of these digestive things, they're so commonly linked to indigestible situations. We talk about stuff like, oh yeah, our digestion's off. But like, if you have a real bad disease in the digestive tract, it's normally linked to some type of indigestible something that happened in your life. You can't digest a particular event or a whole situation in your life. I can't comprehend that. That's just too bad for me to even put a thought to. And anyway, so yeah, there's examples just left and right that just are incredible.
Yeah, no, we need to follow you with a camera. I think it's fascinating. It's so good. And my goodness. And I think one resource I would recommend for people who want to learn more about a lot of this, I know maybe not specifically your field, but just overall how trauma affects our bodies and emotional wounds, is The Body Keeps the Score by Bessel van der Kolk. Like, that will kind of give you the scientific proof, it's a great, and a much deeper explanation than we can do. To kind of expand your thought process of how these things actually affect us. 100%. I think everyone listening, unless your life has been like pain-free, which there's very few people like that, can probably point to something in our life that resonates with one of the stories that you told, just like physical ailments or pain that connects to some sort of emotional trauma and in a lot of cases, we haven't been freed from that, unfortunately. And I wanted to talk to you a bit about just this whole tension when it comes to healing. So on one end, there's maybe this unrealistic goal that some of us have, that we want like our life to be this utopia, to be this perfection, to have all the pain rid from us and just be able to function perfectly. Like, obviously that's not realistic, but we somewhat have a desire for that, right? But on the other end, there's probably more people who just give in to resignation. Just think like, well, my life is always going to be this way, like we said before. And all I can really do is just survive. All I can really do is just get by. I'm curious, what's like that realistic goal or expectation between those two extremes? Like, how can we, on one hand, not despair and give in to like, well, this is hopeless, but on the other hand, not maybe hope that all of our problems in life and our pain will be resolved, though there is a possibility. I firmly believe that there is a possibility that a lot of it can be. So I'm just curious, like, what's the right goal, expectation there?
It definitely can be a fine line in a way, and it's very personal too, depending on, you know, what you're suffering with. You know, some chronic diseases and stuff. Yes, you might not get back to like 100% where you have a super strong immune system, let's say, or you have a super robust system that helps keep you from anxiety, or you have a super robust system that you're never depressed ever again. There is a expectation or a realization that, you know, life is not without any hardship. And as I briefly mentioned before, I think a lot of our society at this point, it's so geared towards comfort, towards convenience, towards no pain, that we actually, we tell ourselves and we begin to believe that that's actually like possible. And I think some of us are starting to realize that if everything is entirely convenient and 100% done for us, we become like, you know, dwindling, you know, can't barely function and do anything for ourselves anymore. We don't know how to do anything because everything's done for us. So I think it's important in the healing process to remember that it takes work. It's actually a never-ending process of living, right? So living is experiencing. We're the center of our beings is our heart, right? Our heart is the center of it all. We're made for love, right? We're made for relationship. We're made for connection. We're made for unity. Mm-hmm. And, you know, as a Catholic too, you know, we're made to unite back to our heavenly creator who created us out of love. And which is also why when we experience hurt from a loved one or from a relationship where there should be love, those hurts hurt a whole lot deeper because they hit us at our core.
Yeah.
Our heart suffers greatly, not by those people who we don't really care about or don't care much about us. Those don't really hurt us all that much. We can just kind of shrug them off and it's not really a big deal actually. But when those hurts come from the ones that we've loved or should love us, our parents or our loved ones of any other nature, those are deep wounds. I also deeply believe, because of the way I see people come in and out of my practice, those who know that we cannot really rely on man because we'll always be disappointed. We are all imperfect human beings. And if we seek for full connection and full satisfaction out of somebody else, any other human, one, it's not fair to that other human because they can't possibly provide everything that you need. And two, it's not fair to yourself because you'll always be disappointed. So there's a spot, a center of our heart that really only somebody outside of our fallen human being can fill. Somebody greater than us who at the end of the day, you know, loves us into being, to experience, yes, there's hardships, but to experience the growth that can come from that. So there's that expectation of it will never be perfect. If we're thinking that, everything will be totally fine, I'll get through this point in my life and then boom, you know, it'll be great. Yes, that's an unrealistic expectation. There will always be hardships, but what we want to be able to do is to be able to tolerate the hardships, to be able to respond to the hardships, not necessarily with so much anger and reactionariness, but maybe with, okay, really don't like the fact that, that for whatever reason, my sibling is going behind my back and talking terrible things about me. No, I don't like that. But I don't need to respond like what I used to respond to. I can take that suffering and I can actually be okay with it. Not just tell myself I'm okay with it. My entire body can be like, okay, I'm okay that they're talking bad about me. I'm okay that other people don't think I'm great. I'm okay with people thinking that I'm really not a good guy. It's like, but if you're doing the best you can, you're doing the best you can. So there's like that expectation of, yes, it takes hard work, but what you're doing is you can change your reaction to what's in front of you. There is a possibility. There is an openness to changing your reaction, which then changes your life. It's first an outlook, an acceptance of where you're at, and then having a realistic outlook. Say, okay, and honestly, if you have a realistic outlook, the level of improvement is actually normally even greater than what your realistic outlook is, if you're open to that healing. Right. And I think that's the next step is openness and accepting reality, then being willing to do something about it and to change your situation, and then to be open to the healing, whatever that might mean for you.
So good. Yeah. And I love the whole idea of, post-traumatic growth, not just, being stuck in the past and always being like handicapped in a sense. And even if, let's say physical ailments can't be perfectly cured, there is a way to kind of move through them and live with them that is truly healing, where you can become a more whole, functional person, even if that particular ailment, illness, trauma, whatever, isn't totally gone. Or maybe a better way to say it is you still have the scars from it, because we can't remove the scars. We can't remove, fully maybe all of the negative effects, but you can grow some mastery around it. You can heal the root cause to where it's not really affecting you as much anymore. And I've seen that in my life and the lives of other people who've, worked with people like you, been through trauma therapy. Maybe 1 minute they're depressed, they're cutting, they're like suicidal, and then they work on healing those root wounds. Next minute they're good. And that, they're not tempted to cut. They're not tempted to suicide. They're not constantly depressed. Like, yes, maybe there's some seasonal component of depression that they have to kind of learn to manage, but overall they're in like a much healthier spot. And so I think, like you were saying, the goal is to be healthier, more whole, more functional, not to be like living in this, like we said, utopia where nothing can go wrong. And, life is so comfortable that there's no pain. It's like that's a joke. Like, we can't have that exactly. And one book that I haven't read yet, maybe you have, and I've heard a lot of people rave about, is the whole Comfort Crisis book. So Comfort Crisis, just talking about how, apparently it's a great book, just saying how, the comforts in our lives have honestly ruined us as a culture in many ways. Like, we don't know how to do hard things anymore. And we really need to get away from that. And so there's, a lot going on there. Definitely a lot to dissect. And I'm sure we could have, a whole nother conversation about a lot of this. I want to give you a chance to respond, but I do also want to hear about your therapy, about QNRT and how that's helped people.
Yeah. Where do I even start? So quantum neurological reset therapy was an answer to prayer for me. As I briefly mentioned before, I had people, more than a few people coming to me for, I have had this trauma and it's having this effect on me, and could you help? And I started getting more that I said, God, if you want me to work with these people, I believe there's more that I could possibly do for them. And if that's the case, could you help me learn it, or help show me where I can learn this? So I was at a seminar and I heard QNRT as an acronym, and he only mentioned it briefly. And when the lecturer mentioned it, I felt like a lightning bolt hit me, and I was like, oh, that's what I'm studying next. And I had no idea what it was. Wow. So I wrote it down in my notebook, and I was like, that's what I'm studying next. My wife loves to tell people that. Yeah. He called me at lunch and was like, hey, honey. She's like, how's the seminar? I was like, it's great. I was like, yeah, but I know what I'm studying next. I'm so excited. She goes, that's awesome. How's the course? And I was, it's great, but this, anyway, she's like, what is it? And I said, it's Q and RT. She goes, what's that? I was like, I don't know. What does it stand for? I don't know. But I know it's going to be great. She said, you're crazy. Anyway, I went home and we looked it up together. I didn't look it up till I got home. And it was an answer to prayer because it addresses adverse events that we go through and how it impacts our nervous system directly. And how those experiences that we go through sometimes get trapped in our nervous system and create patterns of response. And those responses can create imbalances in our nervous system. It takes a quick question for you, Joy. What is it, and don't overthink it, that coordinates every cell in your entire body?
I guess it would be, your nervous system, your brain.
Nervous system and your brain. Yeah. They coordinate 30 trillion cells. And do you know how your body's digesting your food right now? Do you know where it's sending the proteins, where it's sending all the carbohydrates, and how it's doing all that? No. Thank God, no.
It happens automatically.
Millions of things are happening every minute in our body, in our nervous system, that communicates. Trillions of cells together. And tons of messages are being sent at lightning speeds through our body to keep us alive and to allow us to function. And that amazing nervous system that coordinates all these things, it can't differentiate between a physical stress, an emotional stress, or a chemical stress, because the process in which they communicate are the same neurotransmitters, the same chemicals in our body, the same hormones. All of those things are the same. They just communicated as stress. So because of that, QNRT takes an evaluation of the brain and nervous system, and you can see patterns of where different stresses affect our nervous system. And you can even dial down as to time frame period. When was this an issue in your nervous system? Okay, it was also related to a viral reaction in your body. Oh yeah, I had Lyme's really bad when I was 5. And okay, yeah, it was linked to that Lyme's. And oh yeah, that was the same time frame that I experienced this other thing. And it helps us to tie together the nervous system and how different things have affected it. And then finally, it responds to, as I mentioned, the lie detection test. It responds to lies or truth. And so if we want to let go of something, but our nervous system's like, nope, I'm not ready to let go. And you said, no, I'd like to let go of that. We say, all right, let's go. So your brainstem, let's say, right? So we live so much of our life in the limbic system. Limbic system is our reactionary survival mechanism, right? And fight or flight, right? Everybody knows sympathetic response, fight or flight. So much of us are in a sympathetic overload in today's society, more than ever, I think, for many more reasons than one. But sympathetic overload, if we're meant to function, let's just pick a random number at 10, a level of 10 stress, okay, is right here. And we're functioning here, we're doing okay, right? As soon as something blows us over our threshold, our body can't regulate back down. And that inability to regulate back down is trauma to the body. That trauma can get lodged into our nervous system. And if you live up here for too long, you get totally wiped out, you get drained, and you start failing in many more ways than one. And that nervous system just can't take it anymore. And you're more reactive. You can't focus. There are different ways of reacting. Some of it is sleeplessness. It all depends on exactly where in your system it has affected you, and it tells you then how it affects you. And it's because there are patterns in the nervous system. When you hear a sudden sound, that's triggered through a particular part of the brain. When you smell something, that's triggered through a different part of the brain. And all of those are normal neurological pathways that our brain functions, our body functions. So we take all those things for granted. But when you start realizing that when you smell something, you're like, oh, that instantaneously brings me back to my grandmother's room when I was a kid. That must have been, I don't know, a perfume that she used or something in her room that makes me think of my grandma. You know, we've all had instances like that. Or you smell baking cookies and you're like, oh, those were the cookies that grandpa always made for Christmas after, Christmas dinner or dessert. And, all of these things, we have things that can trigger us back. Or the other way around. People smell something and they're like, oh, my ex-husband used to wear that. I hate that smell. Or something like that. People say these things all the time, but we don't realize that, well, that's partially because it's triggering that part of the brain, and that part of the brain is still holding on to that hurt. If you can clear that trigger out, which is how we use cranial nerves, which are the closest thing to the brain, and we use the eyes, which are so powerful for our nervous system. The first thing to grow from the brain in utero. And we used all these things to activate and reprogram. That's what we end up doing, is reprogramming your response, as you just mentioned a moment ago, your response to certain triggers. So let's say, no, it's not all things that are in the past. Let's say somebody's going through something right now in their life. They're going through something right now and they can't escape that relationship. They're a child who lives in the family's house and there's actually no place for them to go right now. Okay, so that's not something that we're dealing with in the past. All these things are not just past. It can be very much present. So no, we're not going to change. You can't change that relationship. You can't change that situation that you're stuck in. So sometimes the issues at home, they have symptoms when they're at home. They're really anxious at home. They can't sleep at home or something like that. And then all of a sudden they go maybe someone else's house and all of a sudden they get a great night's sleep. And the kid's like, well, that was weird. Or all of a sudden, every time they go to school, their headache kind of gets a little bit better. Or vice versa. Sometimes the stress is at school. They're being bullied at school. They're not telling anybody or something. Or you have a teacher who really mean to you, a different kind of bullying, something like that. And they're not telling anybody. But every time they go to school, they get a headache. They end up calling the nurse every week pretty much, and they get taken home. And then you find out later, okay, they're dealing with bullying. So there are certain situations that we can't necessarily avoid currently. But what we can do, and that's what QNRT has been able to do, is change the nervous system's response to it. And that's powerful.
Wow.
So no, the bullying may not stop, or the situation between your parents at home at the moment might not stop, or any number of situations you can actually change maybe in your time right now. But what you can do is say, I'm accepting of this right now, and I'm not allowing it to not allow me to move forward. Or I'm no longer holding on to that and keeping it from allowing me to do X, Y, Z. And so your response, and the fun thing is too, sometimes the spouses of people come in and they're like, what do you do to my wife? Like, she's totally different. Or, man, my husband, he hasn't done that in years. Or like, he's just happy. Oh, one other instance. So I had this kid, and apparently he screamed bloody murder every time they gave him a bath. He was like 2 years old or something, a year and a half or 2 years old. His whole life, gave him a bath, screamed bloody murder. I didn't know this. I was treating him for something totally different. And I was like, hey, he needs to take a bath in some essential oils. I love essential oils also. And the parents like, yeah, he screams bloody murder. I was like, okay, let's see if we can do something that might help this out or whatever. So we did some treatment. And then the next day she sends me a picture of him playing as happy as can be in the bathtub the next day. And she was like, this is a miracle. And I was, it's another experience of the situation didn't change. He's still taking a bath. Nothing else changed in that situation. That's a simple, benign situation of a bath, right? But even benign things can trigger us. Somehow that trigger was linked to something else that was more hurtful than just the bath. And that trigger was what his body was going into, fight or flight. It was going into, I don't know, I gotta survive. I'm freaking out. And a child's response is to scream. Sometimes adult responses to scream too. And, sometimes we're in total protective freak out mode. We all know our nervous system's response to stress, right? If we're about to give a talk or, public speaking and we get a little nervous in our stomach, or, we get a little raised heartbeat, or we start sweating a little bit more. All these things are normal responses we experience every day, right? But sometimes we don't realize that triggers that shouldn't make that happen are making us happen. And that's what anxiety and anticipatory anxiety, all those things are, is like, well, the situation right now is actually okay, but you're interpreting it as not okay. You're interpreting it as, I'm going to die and I need to do something about this. And so you're freaking out. And that's where you're just changing our response to the same exact situation. That yellow car just drove up the driveway and it's okay. It's, it's not a taxi cab who's delivering the guy who came in and raped you. You are now okay with the fact that a yellow car can drive up the driveway. And you don't have to respond with the pattern of, oh, that means bad stuff's going to happen. Not every yellow car driving up means that. And so that's where you're actually changing your response to the same exact trigger. And allowing your body to let go of those patterns. Because we're trained, nervous system learns our name, and learns many more things than we even give it credit for. It learns to react in certain ways. Like, for instance, we know, when we're walking down the street and we get a little kind of creepy feeling and you don't quite realize why maybe yet, but then you kind of see somebody in the corner of your eye, you're like, it's a little off-putting. I'm not sure what's going on there, but I'm not going to stay to find out what's going on. Yeah. I'm just going to kind of go this way. Yeah. You don't know why. You don't need to know why. But for whatever reason, your system was aware of something probably not so good going on down there. And, those are things that our nervous system knows, and it tells us by activating our sympathetic nervous system. But when that gets awry, normal things activate our survival mechanism that you might not want to happen, because that can really debilitate our life. And we want to actually accept what's happened in the past or in the present and, no longer react in the same way, but change our reactions and heal from them. So I don't really know where that just went, but where it came from.
No, it's super helpful. No, and those false alarms that sometimes, set us off, being able to disarm them and move through them, that makes so much sense. So, wow, you truly, Dr. Genn, you have a PhD in this stuff. You truly do on many levels. And well, thank you for explaining it and going through it. I'm sure we could talk so much more about all of this, but I want to make sure if someone's interested in working with you, what do you offer and how do they get that?
QNRT is an in-person only technique. And so I offer that. I'm in New York, in Pauling, New York, and have a practice right out of my house. And I'm here full time now. And I do offer some virtual treatments, generally not for QNRT, but other work. Another book, which is The Emotion Code, second to, and that's also a great book. Dr. Nelson wrote that book, and it goes into some treatment of how the emotions affect the body. And that type of work I do virtually. I do mostly in person just because it's a real connection and a real, a different level of treatment because I'm a physical therapist. So there's a lot of hands-on, a lot of cranial, a lot of implementation of hands-on work with the emotional work. Because again, the body doesn't differentiate the two. So they kind of go hand in hand. And 98% of my clientele I do QNRT with now as part of the treatment, and then help facilitate healing through other avenues that I've been gifted to learn too. So those are really in person, and then I do the virtual work that I do. I keep minimal for the most part, but there can be hugely helpful things, and there are examples of how that works as well. But I don't really have much of a presence on social media or anything like that. My website is pretty minimal, but the best way to probably contact me is by email. Chris at benotafraidpt.com, which I'm sure you'll also put in the link and all that. And also my business number. I'm reasonably good at getting voicemails back or I don't answer generally, but I'll return voicemails. And so calling the business number there is another great way to get in touch with me if there are any questions or curiosities on treatment, anything like that.
Love it. No, so good. Thanks for mentioning all that. And we'll definitely link to benotafraidpt.com. Is that right? And then we'll put all the number in the show notes and everything like that. So thank you so much, Dr. Genn. And one thing I wanted to mention to people, if you're intrigued by this, setting up a call, doing some sort of a consult, I know you offer that too, could be a good next step. I know people will travel to, different therapists or physical therapists in order to get the benefits that they offer, because there's not many people doing this stuff. And so that is certainly a possibility, especially if you're, in that area of the country, or you can, get there, to do some sort of treatment. So I know there's a lot of possibilities there. So I just encourage people, like, think outside the box. If it's something where you're thinking like, wow, I could really benefit from this, but, it's far away, or, maybe I couldn't afford it right now, I would just challenge you to think creatively and figure out a way that maybe you could potentially work with Dr. Genn in the future.
They end up there's nowhere else to turn for them. And they've tried many things.
Yeah.
And so I have many clients that travel several hours to come in, and in the near future, we'll be setting up a better situation where I can to accommodate more people, so that we can have longer periods of time. So Dr. Turner, who was the founder of QNRT, he has a place down in Roswell, Georgia, and he is set up so that he can have people stay in a hotel nearby and do intensives. So he does 3, 4, 5 day intensives where you get a lot of work done in a short, in several days back to back. And that's something that I'm working towards as well. But yes, traveling sometimes, we only need several sessions sometimes to make huge progress.
Love that. No, and if it works, man, it works, and it's better than spending years in an office with, someone who might have good intentions, but they're just that method of therapy, that method of trying to help them. It just
that's
isn't
actually
work.
One tidbit for people too. If you don't see some improvement with what you're doing with somebody, we can be generous and say 2-3 months. If you're not seeing any change, maybe explore other options.
There you go. Second opinion, but at the very least, schedule a consult, a phone call, something.
For years, if it's just not making much of a change, there's better things out there.
It's a waste of time, waste of money.
There is healing, there is growth, and don't allow that to say, "Well, I've already tried." There's more. Never stop seeking for healing. Never stop seeking love and truth.
Beautiful. Well, Dr. Genn, thank you so much again for your time and your expertise.
Your ministry, it's really beautiful, and we all need healing in our lives. So thank you.
Couldn't agree more. Of course, couldn't agree more. I want to give you the last word. What final advice or encouragement would you give to everyone listening, especially people who feel just stuck in life? They're going through pain, especially because of maybe dysfunction at home or their parents getting divorced. What final advice or encouragement would you give to them?
It would be hard for me to say anything other than the words of a dying man, a client, who said to his family, embrace the cross, embrace your suffering. And when you are not feeling loved and you don't believe you're loved by anyone, know that you are loved and that you are cherished. Can't get better than that. So never stop seeking it. For love you will find if you seek.
Again, if you're interested in learning more about how Dr. Genn can help you, I just encourage you to schedule a consult with him, send him an email, give him a call, whatever it takes to just learn more about how he can help you. Now, if you're not ready for that, I wanted to let you know that we have a free video course on trauma that you can go through right now if you wanted to. It's called Broken to Whole: Tactics to Heal from Your Parents' Divorce or Broken Marriage. In just 2 hours, you're going to learn from a trauma therapist who has over 17 years of experience treating trauma. You're going to learn things like why the trauma of your parents' divorce or family dysfunction is so damaging. You're going to be able to identify the root of your struggles, which is often trauma, as you'll learn in the course. You're going to feel validated and less alone in your struggles. You'll understand and better be able to navigate your emotions. You're also going to build healthier relationships and a better life. And perhaps most of all, you're going to avoid passing your brokenness onto the people that you love the most. And so if you want to get access to that free course, again, it's free. Just go to restoredministry.com/broken to whole. Again, restoredministry.com/broken to whole, or just click on the link in the show notes. You can sign up for free on that page and then just start watching the videos. Again, restoredministry.com/broken to whole, or just click on the link in the show notes. That wraps up the show. If you know someone who's struggling because of their parents' divorce or broken family, share this podcast with them. Seriously, if you want to, take like 30 seconds right now to just shoot them a text message with this episode or another. And you can just say something like, hey, I listened to this podcast, made me think of you and everything you have been through with your family. Just wanted to share, no pressure to, actually listen, but just wanted to send it your way. Something like that will go a long way. And I promise you, they will be grateful, even if they don't say much right now. It is going to help them. I wish someone would have done that with me years ago. In closing, always remember you're not alone. We're here to help you feel whole again and break the cycle of dysfunction and divorce in your own life. And always remember the words of C.S. Lewis, who said, you can't go back and change the beginning, but you can start where you are and change the ending.